Title: How Consultation Works in Government Hospitals in Nigeria. Hello, my name is Dr. P. I am a senior medical doctor, and today I will explain how consultation works in government hospitals in Nigeria. In government hospitals, there are two main pathways through which patients receive care. These are the Accident and Emergency Unit and the General Outpatient Department, also known as GOPD. First, let me explain the Accident and Emergency Unit route. This pathway is for accidents and emergency cases that require immediate treatment without delay. In such situations, patient relatives bring the patient directly to the Accident and Emergency Unit. On arrival, nurses assign a bed to the patient. They check the patient's vital signs such as blood pressure, pulse, and temperature. At the same time, the patient's relatives are directed to go to the records unit to open a hospital file if the patient is new, or retrieve the patient's file if the patient has been treated in the hospital before. They also obtain an emergency pack, which may include cannulas, syringes, drips, and other essential items. After this, an accident and emergency doctor reviews the patient. In emergency cases, treatment and life-saving interventions are started first, even before tests and investigations are done. Once the patient has been reviewed and stabilized, the accident and emergency doctor will transfer the patient to the appropriate specialist team. This specialist team will continue the patient's care until the patient is discharged from the hospital. Now, let me explain the General Outpatient Department or GOPD route. Patients whose conditions are not emergencies go directly to the General Outpatient Department. At GOPD, nurses direct the patient or relatives to the records unit. A hospital file is opened for new patients, or an existing file is retrieved for returning patients. After this, the nurses check the patient's vital signs. The patient's file is then taken to the doctor's table. Patients are called in to see the doctor based on their turn. The doctor you see at GOPD is usually a family doctor. The family doctor will review your complaints and request necessary investigations, start treatment where appropriate, or refer you to a specialist team within the hospital if needed. Because government hospitals attend to many patients daily, waiting times may be long. But patients are generally seen based on urgency and order of arrival. This video is for educational purposes only and does not replace professional medical advice. If you found this video helpful, please like, share, follow, and subscribe for more health education videos. Thank you for watching.